what are some of the treatments that you guys offer? What's unique to your clinic?
Now, there's a lot of doctors offering these type of things. You have the plastic surgeons or the cosmetic surgeons. They do a lot of aesthetics. Now, they don't really, other than a little medication here and there, if they're post-operative or they're about to have surgery, they don't really give that many medications. They just either do liposuction, or they give them a breast augmentation, or they do a tummy tuck or something like that. And then you have the functional medicine doctors that treat them as a whole, treating their diet, giving them something to lose weight if that's the same. GLPs are the big thing right now, which are great. I think utilizing them, in the proper sense and moderately is the best way to do that, because those type of medications, as an example, they're mainly for morbidly obese or people with diabetes and that really have to lose some weight to stabilize their glucose levels. And so those are amazing tools to utilize. Well, some people now, you have, the celebrities and people with money that they can afford these things because they are expensive. Especially if you don't need them and your insurance is not going to pay for them because you don't need them. You don't have a reason why to take them, but you can pay out of pocket with them. They were taking these higher doses and they were losing a lot of weight and they look great, but the problem is there's always side effects. And one of the main side effects in those particular, for those type of medications is loose skin, which consequently helps me because they come to see me because I do skin tightening. And that kind of segues into the other thing that I do, which is cosmetic or aesthetics. And so I focus just on liposuction, body contouring. We also do skin tightening. There's various machines that we utilize for that. And then I focus along with that on the regenerative side. Because on the regenerative side, you can use stem cells, you can use exosomes, and those are the kind of the top two. I wouldn't say medications because they're not a medication. They're just particular tissue and cellular structures that we utilize to help the patient, whether that's for pain, whether that's for a fat transfer that you want to really maintain the results that you have, or if that's just for aesthetics to make you look younger, or skin to be better, or tissue to be better. And so utilizing all three of those, regenerative medicine, pain management, and then aesthetics, that's kind of what I focus on to kind of help the patient better. Now, if the patient needs a GLP, I'm kind of turned the road on that, in the sense that I like to utilize those in a micro dosing capacity and at a very, very much lower amounts, as well as with a proper diet, hydration, certain supplements. There's a lot of things that you can utilize and do yourself if you want to put the effort in to make a change in your body.